Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, and I am streaming live from downtown Boise, Idaho. Starting to warm up in Boise. I was talking to Sam before the show, and it's a little bit warmer in Boise than it is in Montana, but not much. But I'm definitely looking forward to spring and summer. So speaking of Sam, we have Sam Ashe. He's a pharmacist on our podcast today, and we came in contact through a mutual friend. It's an interesting story. We'll discuss that on the show too, how small of world it is. But Sam opened a pharmacy, a cash-only pharmacy, doesn't bill any insurance, a few months ago, 6 months ago or so. Sam's correct?
November 15th. So
November,
little
5 months ago. Yeah, 4 months. Yeah. And if you follow us on the podcast and you follow our Moses Lake Professional Pharmacy, you know that we haven't billed insurance for over 20 years, and because we know that it's kind of a ripoff. We've talked about it in this podcast before, and it makes prices go up, service go down, quality go down. So we're going to definitely get into that today. And without further ado, Sam, go ahead and introduce yourself and welcome to our podcast.
Thanks for inviting me. I appreciate it. My name is Sam Ashe, and graduated from the University of Montana in Missoula in the year 2000, and came back to the Flathead Valley. And trying to, when you first get out of pharmacy school, you're like, where am I going to go? Am I going to go to Coeur d'Alene? Am I going to go back to California where I grew up? So there was some decisions we had to make, and we had our little boy at the time was, just a little toddler. And then we're trying to decide, okay, we need to raise our kids in a spot that, would be good for them growing up. So we decided to stay right here in the Flathead, and there wasn't very many positions available at the time. So kind of bounced around and then landed at Smith Pharmacy up in Columbia Falls, Montana in May of 2000, and have been there ever since until last July. Decided to step down and start a new adventure and open a cost plus pharmacy in Columbia Falls. Came across your podcast, my wife did, as we were kind of perusing ideas over the last year or two to figure out how we can be a little cog in the wheel that's trying to fix the healthcare model that we're in right now, and seeing if we could come up with a solution. And we came across your podcast, and they came across some other pharmacies that are already in the process of doing this, just startups, and then also ones that have been doing it as long as you have. So we said, hey, if these guys are doing it, let's jump in and go for it and see if we can help our community, because being a community pharmacist for 20 years in the same store in the same town, it's a little town of, maybe 7,000 people in the town, and, the surrounding areas were, with the Flathead Valley, we could be up to, maybe 75,000 now with the valley. So population's expanded. So, it was just, we need to figure out how to help these people save money, because I saw 20 years of them just overspend, especially when I knew the cost of the medication. So we just set out on the new adventure, and we're excited to offer it not only just to Columbia Falls, but to the valley, and then hopefully statewide with options to mail. So we're excited.
Awesome. I'm happy for you, and I'm so excited for the direction that free market healthcare is moving in, because I think it's a big need. I think, and until people know that there's options out there, they're going to be stuck in the insurance model. And the insurance model, as we've discussed before, is very expensive and doesn't give the best service. So tell us about a cost plus pharmacy. What does that exactly mean?
So cost plus pharmacy, we're doing the true cost plus. So there's no membership, there's no discount cards, there's no, special club. All we do is we just acquire the medication from wholesalers, and then we charge the cost of the medication plus the vial, label, lid, e-script, all the fees, the small amount that they are. Thankfully, we have no insurance, so we don't have any switch fees or anything like that. So it's just the true cost, and then added is a pharmacy services fee to the prescription, and then that's what the patient pays. So in our pharmacy management fees, differ depending on if it's a 30-day supply, 60-day supply, 90-day supply, just depending on what that is. We have set fees to cover the cost to run the business. So,
Wow, that's
yeah,
awesome.
that's
Yeah.
it's very simple.
Yeah, right. All right. And as you know, with insurance model, it's not simple at all.
Yeah.
So, yeah. So tell us there's usually in a story when whether it be a doctor, whether it be a pharmacist that finally gets out of the insurance model. And I don't think I've met anybody in healthcare that likes the insurance model. It's just constantly something that people complain about.
Yeah.
So there's usually always a final straw, Sam, that was like, okay, that's it. We're done with this. We're going to do something
Yeah.
different. Can you tell me what
Yeah.
that is?
There were several little straws, but the big straw was a patient who was getting 2 eye drops for their cataract surgery coming up. It was a Medicare D patient, and I was ringing them up at the till, and I just happened to be the one ringing them up at the time. They were paying 140, like right at 130, $140 for those 2 eye drops. One was the prednisolone, the other one was the fluoxetine. Medicare D was $140, and I knew the cost of those. And the patient was there in tears because they were going to have to decide, is it important to get my medication for my cataract surgery or my limited budget? I'm going to have to sacrifice something for the month, be it food, be it whatever they had to sacrifice for those 2 meds. And I knew if I had my own pharmacy, I could probably get them out the door in the neighborhood of $40 to $45, a third of the cost. And to see someone that I had served in my community for 20 years to have to decide if they were going to have, food or if they were going to have eye drops or cataract surgery, I just thought I can't do this anymore. And that was just the final straw. There were several straws before that. And being in a small community, everywhere I go, be it, soccer games, softball games, Rotary Club, wherever I go, people knew who I was because I was the only pharmacist that has been in Columbia Falls for 20 years. The rest of them have all come and gone. So everyone knew who Sam
Right.
was. And so you have this reputation in town, and they're all coming to me going, why is the pharmacy so busy, so backed up? Why are my medications so expensive? And so it only took just a few patients to get me to the edge to where like there's got to be a better way. And that I came home and told my wife, that's it, no more. We're not doing this anymore. You better get ready because this
Yeah, right.
comfortable life of showing up, getting a paycheck, and having quote unquote insurance and a 401k is out the window. We're going on our own. We're going to do small business, whatever that entails. We're going for it. So
Well, I'm glad you did, and I'm sure your patients are glad you did. And the future is bright for free market medicine because
uh, yeah.
just like you were talking about, I mean, one third the price. And
Hmm.
just help our viewers and listeners when they charge that when you had to charge that insurance price, that $140 or whatever that price was for those eye drops, even though you knew what the cost was, there's nothing, your hands were tied as far as, well, sorry, I'm just going to give you a discount anyway. You can't do that, correct? Can you explain that?
Exactly. Yeah. You can't change it because obviously we're work for a corporation. So as soon as we bill that off to the insurance, Medicare D, they dictate the price that the patient pays. So there's no way I can adjust that unless the patient says, "Hey, can I use a discount card?" And then you go, "Oh, okay, let's try to run it through a discount card." You have one, and certain corporations don't let you say, "Hey, I will find a card for you." It's up to the patient's responsibility to find a card. So you kind of had to walk certain patients through and say, "Hey, ask me if we can use a discount card," and then we can get into the whole issue of the discount cards and how they're bad for the pharmacy, but yet
Right, right.
but yet they're good for the patient because it actually has shown what the actual cost of the medication is. So, but working for a corporation, your hands are tied. You can't just go in and change the price because you feel bad.
Yeah.
That this is the cost. And over the years with the pharmacy software and the big corporations, they've taken the the actual cost of the medication and hidden it in the program to where you can't see it. unless you go in and look specifically in a transaction profile, and you go in and look and see what the actual cost was and what the actual reimbursement was. And even then, you don't know what the DIR fee is 6 months down the road. So it's such a opaque system that you don't know actually what you're getting paid, what the actual cost was. So the system is just very, very opaque, and it's very hard to see through. It's like going through a maze in the dark. You have no idea what you're doing. You're running into walls. It's a messy system.
It is. And, basically what you're saying is you got out of that system, and
Yeah,
instead of having to bill insurance, find out it's expensive, maybe find them a discount card, maybe not. Now you just deal directly with the consumer and you charge a fair price already. You have a little markup on the medication, and it's a done deal. It's that
done.
simple, right?
It's I have not called an insurance company for 4 months. It is the most beautiful thing. And I would guess we spend half of our day, 50% of our day in a typical pharmacy on the phone or adjudicating or fixing the adjudication problems with the insurance. I would bet half the labor in a pharmacy is spent on an insurance that reimburses you 60 cents or $1.20 or a negative. I mean, you could lose money on reimbursement 6 months down the line with the DIR fee. So it's just an ugly system that has no benefit for the pharmacy and no benefit for the patient.
No, absolutely not.
Mhm.
No. I mean, I often say it's drug companies in collusion with insurance companies to create a cartel to just take advantage of the system, and that's really what it's done, and just made things really expensive.
Yes, I have a couple of physician friends and pharmacist friends that call them the mafia because it's basically what's going on.
Yeah,
It's embarrassing that we have allowed this to happen in the pharmacy profession. You
it
know,
is. I'm with you, Sam. And you know what?
yeah,
I mean, I you might not be there yet, and I don't want to put a future thoughts into your mind. But one of the reasons my wife and I we don't we kind of quit going to a lot of traditional pharmacy educational stuff and networking with other pharmacists, because all they could complain about was insurance, insurance this, insurance that, insurance this. We got tired of hearing about it, and we just told them, it's like, look, you have a choice. You
yes,
don't have to put up with this. Oh, you have to take insurance. No, you don't. And you're a perfect example of why you don't. We have a choice to stay in that environment or not as pharmacists. And if you don't like
yep,
that environment, and most pharmacists don't, then do something different. That's the only
exactly.
thing that's going to change it. I don't feel sorry for pharmacists that stay in those environments. In some ways, Sam, and I'm going to use you as an example because you got out of it.
Yeah,
And you might feel a little bit convicted. You might have been a little bit convicted when you had to charge that patient 3 times what it
absolutely.
should have been. And you know
Yep.
what? Essentially, Sam, when you were doing that, you were an accessory to the crime.
Oh, yes, I agree.
Yeah, and pharmacists or doctors that are in the system and stay in the system, that
Mhm.
keep perpetuating it and keep doing it, they're an accessory to the crime. And I felt like I just couldn't do that anymore. And that's one of the
Yeah,
reasons I got out, because it's like, I'm just making this thing worse by keeping on
exactly.
doing it,
Yep.
supporting it.
Yep. Yep. Yeah, over the years, I got to be manager for a period of time, and I saw where we had given a certain amount of labor, and I saw that labor shrinking over time because reimbursements were down, and yet our workload was doubling. And we just allowed them to keep stepping on us and stepping on us. And I just saw the patients overspending, and then the labor getting shrunk, and then all of a sudden you're looking at the PBMs, and they're in the all of a sudden you got three PBMs running 80 to 90% of the pharmacy transactions, but yet they're in the top 20 Fortune 500 companies in the US. They're making billions of dollars, but you can't give me an extra staff person. I got to cut another staff person and another staff person. I mean, at one point, I was down to two full-time pharmacists, and they were shrunk. I would say they shrunk our technicians down to maybe four full-timers, and we were filling over 400, 500 prescriptions a day, plus giving 1,500 shots a year, plus doing COVID antibody testing. And it was absolutely insane to where they brought us. And I was like, I'm not going to allow this to happen anymore. We have to step out and change something, or it's just going to continually get worse and worse and worse. And
Yeah.
yes, accessory to the crime, 100%.
Yeah.
And that's why I had to change. It's just this is not good for the community or for pharmacy as a profession.
I agree. Yeah, or and healthcare in general,
Yes.
because it's just perpetuating the situation.
Yeah.
So, how's your pharmacy doing? Do you like what you're doing now?
Absolutely. I would
Yeah.
never, ever, ever, ever turn around and go back into a traditional pharmacy that builds insurance. It's the
Uh,
most freedom I have ever had in pharmacy. When you come into my pharmacy, if you're a patient, I have set my model up to where it's pharmacist heavy. So when you walk in the door and you're looking for an OTC med, you get a pharmacist. You get one-on-one with a pharmacist. Every person that walks in the door gets a pharmacist. So we're loaded heavy on the front. We just started, so it's just me. I do everything. So
yep.
my goal is to obviously fill enough prescriptions to create another position for a technician, and then also we're expanding the front end to be a wellness, health and wellness center with all the supplements like orthomolecular, Thorne,
Yep.
Claire, Pure, all those, and move from the traditional medicine into a functional medicine and work from that direction. So, but it's the most freeing thing we've ever done in the practice of pharmacy, and it's absolutely beautiful. I would never change it.
I love it. And one of the unfortunate parts, Sam, is that what as you know, there's a lot. What some pharmacists do is instead of doing something innovative like you've done,
Mhm.
they just get out of the profession completely.
Yes.
And the sad part about that is then it's the same thing with doctors. I have doctor friends that just say, I'm out, I'm done with medicine, and they're good doctors, you know.
Hmm.
So it's good that you didn't get out of pharmacy because patients need people like you. And if you just got fed up and says, "Oh, I'm done," and don't want to, don't want to open a an alternative type pharmacy, then
Hmm.
patients wouldn't get the benefit from your knowledge and your services. And that's why we have to do innovative things in the marketplace so patients can get taken care of in a different way without the insurance model, so they know a different way.
Exactly. And that's the biggest hurdle that I've seen so far is getting the patients to understand this way that existed before insurance came along, you know, and now we're trying to get them out from being brainwashed that insurance is the way to go. It's the biggest hurdle for them to understand that insurance is not the best option when it comes to generic medications. 90% of what we do in a pharmacy is generic medications.
Right.
And the average price of a medication costs maybe the price of a bottle of Tylenol. Most of what we get is inexpensive because the generic marketplace in America is there's so much competition that it just drives the prices down, and there's no floor. I mean, you know how much amlodipine costs. It's pennies. I mean, it's
Right.
absolute pennies. But yet, when you bill usual and customary through insurance, it's an enormous amount. It's just amazing all the hurdles I have to jump, but we're slowly but surely getting our patients trained and educated that insurance is not the best option.
Yeah. Can you give an example? I've been out of that realm so long, but can you give an example of like amlodipine that costs pennies? Um, isn't I mean, I've heard some patients call and just say that, yeah, I went to Rite Aid and they billed my insurance and it was going to be $50 for 30 amlodipine. When
Yeah.
in reality, we don't do a lot of regular medication. We
Hmm.
do mostly compounding and of hormones, but
Yeah.
when in reality, I could charge them like $20 for a 100-day supply for amlodipine.
Yeah.
Can you give an example of that since you'd be closer to that than I would?
Sure. One of my very first patients is a rheumatoid arthritis patient on 10 meds, and one of the meds they're on is leflunomide. So um, that medication for a 90-day supply through their insurance was several $100s for a 90-day supply. I can get all 10 meds for my patient for $150 as a 90-day supply for 10 meds. So that is the cost of the drug plus my services fee for 90 days. Now, built into my plan is I have a catastrophic plan built in. So after 5 meds, I don't charge a pharmacy services fee because I've already DUR'd your profile at that time. If I'm filling all 10 meds right then, I've already DUR'd. By the time I get to the fifth med, I've DUR'd your profile.
Okay.
I know exactly what you're taking. So it doesn't take that much extra time to do the other 5 meds. So I just do a pharmacy services fee for 5, and then after that, I just charge the cost of the drug by a label lid. So built into that plan, so this patient's walking out the door with 90 days of meds for $150, and they they go away for a couple months in the winter. So we filled an extra 90 days so they could take that with them, so they didn't have to worry. So that was their biggest concern. Oh no, I'm going to be gone. Can you fill that early? Because my insurance doesn't let me fill it early. So they walked away with 6 months of meds for basically under the cost of one of their meds, the leflunomide, through their insurance. And they're paying a monthly, and they still have their insurance. So they're still paying their monthly premium,
Right.
thinking that their insurance is going to give them the better deal. So trying to educate our patients of, 20 to 30% of their insurance premium goes to drug costs. So say you have let's say a $500 insurance premium per month, 30% of that goes to having a drug plan, which would be $150. So $150 a month just to have prescription insurance, but yet you can walk out the door for 90 days of meds for $150. Why even have prescription insurance if you're on generic medications and they're affordable? All it does is just make the PBMs or the insurance companies rich, and that's why the top three are in the top 20, 25 Fortune 500 companies. They're making billions.
For
And
sure.
we know the names. I mean, it's three-letter, it's Optum, it's United Healthcare, they're
Yep.
making billions off of off of the system. And obviously, you know, independent pharmacies aren't, because they're closing down. I mean, the last independent pharmacy here in Kalispell had to sell out because they weren't going to make it with the current system. They were losing too much in DIR fees. So it's just, once I found out how inexpensive these medications are and how we can get them in the hands of the patient, it's, I mean, our first patient, he was super excited for $150, 90 days. It's just a beautiful system. When you remove
Yeah.
that middleman who's ruined
Yeah.
it.
That's unreal. And, I'm sure there's a ton of examples like that. And I
Tons.
appreciate you. Yeah. I have for years said this, that, prescription insurance, insurance for prescriptions is a ripoff. It's a
Yeah,
complete ripoff because, like you say, most drugs are generic. They're
yeah,
super, super cheap.
yeah.
So I've challenged somebody over the years, and I still will take this challenge. There is no disease state that you can't treat, besides maybe cancer, HIV, some of those like that,
Mhm.
for less than $100 a month on prescriptions, pretty much
Yep,
really easily. Even diabetes. Now we could
yep,
go into
absolutely.
diabetes. Yeah. Now diabetes, type 2 diabetes, some of their medications are more expensive and stuff, but
Mhm.
um, let's face it, we've talked about it on this podcast many times before. If you change your lifestyle, you probably don't need type 2 diabetes medication. So that's the main thing. And as a pharmacist, now that you have time and you're going more into functional medicine, you can educate patients on
Ab-
diet, nutrition, exercise, and why they
yeah,
don't need certain meds, right?
absolutely, absolutely. People think that as a pharmacist, I want you to take more meds, and that's not necessarily true. I would rather have you eat properly, exercise, and then maybe have to take a little metformin, which is pennies.
Yep. Yep.
And in the long run, that's probably going to be more beneficial than taking a $400 bottle of Jardiance and then just eating what you want,
Yeah. Yeah.
and then having to get up all night and go pee because Jardiance is just it
I'm
wrecks your blood.
I'm sorry, Sam. I when that drug first came out, my wife and I were like, "Wait a minute, you're just gonna
Yeah,
pee out the extra sugar? That doesn't
yeah,
make any sense at all."
yeah,
I
yeah.
mean, and then you got all the complications with that, and it just, yeah. So I'm not. I've said it many times on the podcast before, but I don't believe in most in general in type 2 diabetes medications to treat patients long term. I think it's a
Mhm.
lifestyle issue, a diet issue, and they can get off those drugs.
Yeah.
So, speaking of diabetes and expensive medications or inexpensive medications, you tell me. I'm going to put you on the
Mhm.
spot here. Um, we talked about insulin, how expensive insulin is.
Yeah.
So, do you sell insulin at your pharmacy for cash?
I have not yet. I've had
Okay.
several patients call and ask. I did. It's funny because I did contact Novo Nordisk and I said, "Hey, I'm in rural America, and you allow Walmart to sell your Novolin N and Novolin R for 25 bucks.
Yep.
Will you supply it? Can I have a direct contract with you? Purchase it straight from you? Because if I purchase it from my wholesalers, it's over $150 a bottle. But yet I can drive, 20 miles to Walmart and buy it for 25 bucks. So I have sent several patients to Walmart and said,
Yeah.
Novolin N, Novolin R, 25 bucks. But Novo Nordisk just put me in a circular loop with emails and said, call the help desk. And so that would be one of my milestones to reach, is if I could contract right with Novo Nordisk and sell N and R for 25 bucks. And then, as you know, generic Novolog, Humalog, generic Lantus have all come out. And I believe Walmart came out with a generic, either Humalog and maybe a generic Lantus that they're selling for the $75 range. So there is movement on that front as well with some of the newer insulin. So, but one of my milestones would be able to contract and offer that to the same price as Walmart does. Why should only Walmart's be allowed to offer life-saving insulin for 25 bucks when every other pharmacy has to pay 150?
Well, and especially when you know that Walmart's not paying 150 bucks for the vial, or $100 or whatever, they're not losing $100 on it, or so they're probably not. Walmart was my first job out of pharmacy school, and I remember we were selling insulin for like 15 bucks, Humulin N, Humulin R for like 15 bucks a vial, and it was costing us right at 15 bucks a vial back then. So we didn't make a lot of money on it. I doubt Walmart's making a lot of money on the Novolin for 25 bucks, but they're not losing a ton of money either. And yeah, I mean, the drug company should just extend that to every, that wholesale price to everybody, so all patients can benefit at all pharmacies.
Well, and if manufacturers are offering you to be able to get Lantus or to get Humalog for a $35 copay, somewhere along the line that's got to be the cost somewhere around that point. So,
right.
Why are patients paying $500 for a box of 5 Lantus pens? So there's definitely needs to be some light shed on that, definitely, as we go forward. I agree.
Price of insulin has been a hot topic, and I do. One of the things is, and I'm glad that you brought it up, is that at least we do have options like Walmart, $25 a vial for Novolin, and I'm glad for that. And our first podcast, episode number 1, my brother, my nephew's a type 1 diabetic, and I kind of worked with my brother to switch him over. They had him on insulin pumps and all this fancy designer insulin, and it's not really necessary. I mean, if you watch your diet and you control what you eat, Novolin, Humulin N, Humulin R works just fine. And I don't necessarily think the pumps or the longer acting designer insulins or faster acting insulins are any better, honestly. Now that they're generic, if they can come down in price, I might start recommending them somewhat. But diabetes does not have to be expensive to treat. It can be, when you get a vial insulin for 25 bucks. So that's one of the things I want to, I love you getting that message out and not being afraid to send people to Walmart. Walmart might not be my favorite place, and it might be competitors to you and I as pharmacists, but I'm all for helping the patient. Say, hey, no, 25 bucks a vial for Novolin. They're like happy. I mean, they're like, this is
exactly.
Cool.
Yeah. I'm into reducing. My number one priority is my patient's healthcare outcomes. So if I can get them to stay, if they can get 5 times the amount at Walmart and take better control because they have more money in their pocketbook, that's great. That's in the position I'm in now. It's beautiful because I can say anything I want about any pharmacy, I mean, I have nobody with their thumb on top of me anymore. I don't have a PBM that can come after me. I don't have another pharmacy that can come after me or a district manager that can come after me. I'm just my own little self in my own little town with my own, my own model. It's beautiful. The freedom is just undescribable.
It's liberating. It
is absolutely.
Yeah. I will tell you, I've said this before, and the number keeps getting higher. But you mentioned that you'll never ever go back to traditional pharmacy. I couldn't do it for a day, Sam. And I've told people, you could not pay me enough money to go back. I wouldn't do
No,
it for $10 million a year. I'm serious. I
no.
like my sanity too much. I love my life. I've got a comfortable life. I am not going to ever go back to that environment. That's how bad it is.
Yep.
You know,
It's bad. When I was manager, I had several technicians that had, you know, the the watches that showed their heart rate, and I had several. I mean, I can count on on my fingers how many I sent to the ER or sent to the doctor because their heart rate was out of control. They're having panic attacks, having heart trouble, and these are young kids in their 20s, 30s, and it's the environment that the staff is put in is unethical and unprofessional. And I would never recommend ever going back to that environment. Never.
that is just, yeah, that I don't think people realize how bad it is.
It,
You know, and until you've worked in that environment, it's yeah. And
yeah.
I haven't been in that environment in 20 years. So, and it's got to be worse now, I'm sure.
Yeah, I think if the public knew the danger that their health is at by using those pharmacies, they would not go back. If they understood the stress that the staff was under and the amount of workload that is on top of them, and all it takes is one little mistake, and you could accidentally, hurt an individual, God forbid, put somebody in their grave, and that is just a horrible position for a pharmacist or a pharmacy technician to be put under. And there's no way I would ever go. I mean, it is the worst place to be as a pharmacist. You're not helping the patient and you're not helping yourself. And you might think you have it under control and you're awesome because you can fill 400 scripts a day, but until you remove yourself from the situation and you step back and you go, I feel like 100 pounds has been taken off my back since I've stepped out, and you can see it, and you're just like, wow, I can't believe I let myself get under that much stress and that much pressure just to perform. It's pretty amazing to get out and to see it from the other side. Because when you're in it, you don't realize how bad it is until you're
Right.
removed from it.
Right.
Yeah.
And then you're doing something different. Then you realize like, oh my gosh, that was horrible. Yeah.
Yes. Yeah. Absolutely.
So as we wind this podcast up, Sam, tell me what you have a passion for.
My passion is to, number one, healthcare outcomes for my patients, and I know they have been jaded and been kind of brainwashed with the healthcare system, with the insurance, and what I would like to do is just expose and put light onto drug pricing and how affordable medications are. My future, I would hope that we could take all the money that we put towards insurance and in our premiums, if we could just focus all of that and move it on to maybe the more expensive or specialty drugs that where that money could be focused, and then allow all the generic medications to be just in a competitive open marketplace, and that would just drive prices down because as soon as we remove the insurance from the generic marketplace, it just drops the floor even more because now you're going to have competition. And unfortunately, we have too many people racing to the bottom, and it's not a race to the bottom for me because I offer a service, and my service as a professional is worth something. And I'm afraid if we all run to charging a $3 service fee, like say Mark Cuban is for his cost plus pharmacy, we're taking the pharmacist knowledge and the pharmacist service that we offer to our customers, and we're just bottoming it out. And I think that's not good for pharmacy in the long run. So we need to make sure we put value into it because there's many studies that show pharmacists reduce healthcare spending for our patients overall on a year-to-year basis, and we have value. So we can't race to the bottom, but yet medications are almost already bottomed out. I mean, how much lower can you go for something that's a nickel or a dime a pill? I mean, we're going to go down to a penny next.
Right.
There's not much more floor to drop out. So the competition is going to be a service competition. And so if you go into the current pharmacy model right now, you go into Walgreens and you stand, six cars deep in a drive-through or 10 people back in the pharmacy line. You come into my pharmacy, you get a pharmacist right away. So the competition is going to be a service-based, health outcome based. And so my goal is to shed light for the public to see that we can help you reduce your overall healthcare outcome spending, less hospital trips, less ER trips by working through from a functional medicine side, starting with diet, exercise, and nutrition, and then maybe some medications to supplement you. And, because there's always going to be disease states. We can't get away from that. We can just manage them in a better way. But the current pharmacy model will not survive. 10 years from now, the current pharmacy model with PBM in charge will not survive. And so my goal is to make pharmacy survive what they're going through and show there's a better way for pharmacists to practice. And it's absolutely the most freeing experience I've had in my pharmacy career. So
it's rewarding
that's
too, huh?
I couldn't hear you, sorry.
It's rewarding too, huh?
Absolutely. We have changed so many every day there's a patient story I could tell you.
Yep, I love it. And when you were working in traditional pharmacy, how many patients thanked you or sent you an email or whatever over a 20-year period?
Thankfully, it's small town, and when I started at the pharmacy I originally was at, it was small, and we had grown it to massive over the last 20 years. So there was some patients that really, when they came in, they sought me out, and they were very appreciative. But if you're stuck in a big city, I understand. You're just not going to get that. You're just going to go in, check scripts, and go home and sleep, and then you're going to get up and do an over. You're just not going to get that patient interaction that you get in a small town. But now I've taken it to the 10th degree because I get to help every single one. So that there was that little satisfaction there, but now it's awesome satisfaction to help.
Yeah. And I want to back up on Mark Cuban because he's been in the news a lot lately for basically owning a pharmacy. And here's what I got to say about that whole thing is that you already said it. First of all, we can always get a cheaper product. There's always a way to get a cheaper product. So like you say, drop it down. Eventually it can't go down anymore.
Exactly.
But there's three things in any free market exchange, and it's price, service, and quality.
Mm-hmm.
And you mentioned it. It's when the price gets so low, it doesn't really. It's service and quality that matter. So and service is so important, and it's hard to get good service anymore. And here's what I challenge Mark Cuban, or anybody that's going to use his specialty compounding pharmacy to create cheap drugs, which he really used a loophole in a 503B compounding pharmacy to take advantage of making cheap drugs. And that was the problem when I think the FDA made that law, is that I knew that there was it was basically going to create one or two big compounding pharmacies to do that. And basically what Big Pharma's done. So there's going to be two or three big pharmacies competing for that market, and let Mark Cuban do it. But here's what I got to challenge. I dare a patient to call up Mark Cuban and say, hey, what's the side effect of this new medication that your pharmacy made for me? Right?
Yep.
But
Absolutely.
when you own the pharmacy and I own the pharmacy and we're pharmacists, we're accessible to the patients, and we can give them our knowledge, and that's worth a lot of money.
It's absolutely, you can't do that with mail order. I think if you open one of these pharmacies in every town in America, you are more efficient and more affordable than mail order pharmacy. Right off the bat.
Yeah.
I mean, Mark Cuban's pharmacy gives a $3 pharmacist fee, but charges $5 to mail. So right there,
really? That's interesting.
It's only worth $3, but the mailing's worth $5. So right there, it shows me that the mailing portion is more important
valuable
than pharmacist. Yeah, more valuable.
Right. Exactly. So Mark Cuban is basically telling the pharmacists that work for him that the mailman is more valuable. And I'm not disrespecting mailmen. They're very important.
No, absolutely not. No.
But he's basically saying to his pharmacists that work for him that the mailman is more important than the pharmacists that work for them. So their 6 years of school means nothing.
Absolutely. So, right? And you said accessory to the crime, and it's like we've allowed this to happen to our profession. When I saw the $4 generic plan at Walmart, that was the first slippery slope. And then to watch the PBMs reimburse us 60 cents for a prescription, we've been reduced to just pill counters. And at the previous pharmacy, I didn't even count pills. That that's done away with, so we've just been reduced to the final check. That's what we're reduced to, is the final check, and it might be worth $1. And that's embarrassing as a pharmacist.
It is, but right. But you know what, Sam, you got out of it, and kudos to you
Yep.
to doing that.
Absolutely.
You're no longer
Yep.
accessory to the crime. Pharmacists that are doing that, if any pharmacists are listening or watching, you do not have to do it. And yes, you're an accessory to the crime if you are doing it. And there is a better way to do it. It's much more rewarding, and you will be liberated. Believe me. Just listen to what Sam has been saying for the last half hour.
Absolutely. Yeah, it's amazing that you can open a pharmacy with maybe a $10,000 or $12,000 inventory in maybe 300-400 square foot. I mean, the footprint is small, and you can have a nice little front end, and you can take care. I mean, most of our patients have insurance, and they choose to use us because of the quality of the service.
Right. Yeah, that's awesome. I love it. So, Sam, if anybody wants to get a hold of you or has questions for you, what's the best way to get a hold of you?
Several ways. We are on Facebook, on Instagram. It's Beargrass Gift and Drug. We're also beargrassgiftanddrug.com. And then you can email us at info@beargrassgiftanddrug.com, or give me a phone call here. Our number is 406-897-2613, and we would love to answer any question and help out you in your pharmacy adventure, because it is definitely an adventure out there trying to navigate the pharmacy world with prescriptions today.
Well, I love it, Sam. Welcome to the world of free market pharmacy. And I'm just so glad that you're on our podcast today to share this story, because I'm hoping that we are starting. It's not really a new movement, but I'm just hoping that this is the beginning of many, many more that realize that the insurance part of pharmacy is a racket, and there's a better way to do it. So thank you for stepping out.
Thanks for inviting me, and I'm glad I came across your podcast. I think the first one I saw was Haley Miller out of Missoula, and it just sparked a fire that's unstoppable now.
That's awesome. That's awesome. I'm glad. Yeah, that's good to hear. So, and I sent you a copy of my book too. I think you found my book online too, because you were talking to a mutual friend pharmacist that you read my book, correct? Yeah.
Yes,
So,
and then I passed it on already to another friend that is type 1 diabetic, and I'm taking her step 5 to the healthcare solution. Is providers need to get out there and have a cash-based model, and taking it to heart and pushing it forward.
awesome.
And then we'll be hopefully joining you in the next 6 months in the compounding world. So we're gonna bring in compounding efforts for a season.
I love it.
We're excited.
So we usually make a couple annual trips to Montana in the summer to go mountain biking. So we'll definitely have to stop by into your pharmacy, and I'd love to see it.
Awesome. And we would love to see you too. So stop in and say hi.
Perfect. All right. Well, thanks everybody for tuning in to Health Solutions with Shawn and Janet Needham today. Thank you, Sam. Thank you for listening to Health Solutions with Shawn and Janet Needham.